U.S. Department of Health and Human Services, HHS, just made a bold move that's sending shockwaves through the government and beyond. They've announced the layoff of around 10,000 full-time employees. It sounds dramatic, right? But here's the kicker. The goal is to save taxpayers a whopping $1.8 billion each year. But what does this really mean for you and me? This isn't just a random decision, it's part of a massive restructuring, one that's been brewing under a plan called the Department of Government Efficiency Workforce Optimization Initiative. Created by none other than President Donald Trump, this initiative promises to shake things up at the HHS, with expectations that it will reduce the department's workforce by a total of 82,000 to 62,000 employees. This follows previous efforts like early retirements and a controversial fork-in-the-road program that offers full pay and benefits until September for those who choose to leave. So why such a drastic step? According to HHS Secretary Robert F. Kennedy Jr., it's all about realigning the department with its core mission and focusing on one critical area, the reversal of the chronic disease epidemic. Kennedy emphasized that the goal isn't just to trim down the bureaucracy, it's to do more with less. Imagine getting the same, or even better, services at a fraction of the cost. Sounds pretty appealing, right? But what does this streamlining actually look like on the ground? HHS plans to consolidate its 28 divisions into just 15, including the creation of a new Administration for a Healthy America, AHA. The goal? To focus on public health issues like maternal and child health, mental health, and HIV/AIDS, while eliminating the redundancies that can slow down progress. For example, 5 of the department's 10 regional offices are set to shut down. That's a significant shift in how the department operates. A big part of this restructuring is the centralization of core functions like our, IT, procurement, and policy, areas that have often been fragmented across the department. Kennedy also pointed out that transferring certain programs to the AHA will break down artificial barriers between them, leading to better coordination and more effective services for low-income Americans. Here's where things get even more interesting. The HHS is also working to strengthen the Centers for Disease Control and Prevention, CDC. The Administration for Strategic Preparedness and Response, ASPR, responsible for national disaster and public health emergency response, is being transferred to the CDC. This move is intended to reinforce the CDC's core mission of protecting the American people from health threats. Of course, no reform comes without controversy. Critics might argue that this reshuffling could lead to even more confusion or inefficiency. Will the department's newly centralized focus really lead to a healthier America, or will it just be another layer of bureaucracy? And while the government is promising to combat waste, fraud, and abuse, only time will tell how successful these changes will be. But one thing is clear, the HHS shakeup is about more than just cutting jobs. It's about shifting priorities and trying to tackle long-term health challenges. So, the next time you hear about government layoffs, remember, it's not just about numbers on a page. It's about a much bigger plan to rethink how we approach healthcare in America. What do you think? Will this new direction really lead to a healthier future, or is it just a lot of government jargon?